This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 8 in a 58-part series of videos of the entire book to give you background information as well as enable you to see what's inside this book for treating heart failure, preventing heart failure, as well as essentially a cure for heart failure and heart disease. We'll turn to Chapter 5 and magnesium. This is the first and most important ingredient or supplement for heart failure recovery. Its value is 1, which is critical. The recommended dosages are magnesium taurate, 1 tablet 4 times a day. That is 1 for each meal plus evening. And 1 tablet of magnesium malate 4 times each day. Magnesium is a simple mineral, not very expensive. It's in fact called a macromineral because it's needed in very large quantities in the human body. Beyond the age of 50, most Americans suffer extreme magnesium deficiency. Estimates are 75 to 80% of the entire U.S. population are deficient in magnesium. Primarily processed foods remove magnesium and potassium, adding sodium, and therefore leading to a diet that creates a deficiency so widespread that it may be the cause of even high cholesterol as well as heart failure. Magnesium regulates cholesterol production just like a statin drug, but it does so naturally with no side effects. This is covered in a footnote number 24. Magnesium protects against myopathy, and they target the reductase enzyme. It also lowers LDL cholesterol. Nearly all heart attack victims have very little magnesium left in the body. Doctors debate whether the heart attack burned it up or the heart attack was a result of extremely low magnesium. In any case, continual steady dosage is extremely important. If you have active kidneys, no kidney disease, any excess magnesium is excreted through your urine. The kidneys regulate it. Sufficient magnesium can regulate high blood pressure and lower it, metabolic conditions, as well as cholesterol. And it is essential to over 300 enzymes in the body, as well as creating new DNA, RNA, glutathione, and bones. All muscles, including the heart muscle, depend on magnesium to provide energy production from ATP and to give the heart strength. The typical human body has 25,000 milligrams of magnesium, and more than half is in the bones. Persons with the highest magnesium level in their blood experience the lowest risk of heart disease and risk of sudden death. The arterial sclerosis risk and community study followed 14,232 men and women. Those with the highest level of magnesium in their bloodstream had a 38% lower risk of sudden death. This is what happens to a heart failure victim. Their heart stops, and so it's called sudden death. Not a heart attack, but just sudden death. Other clinical studies show a 34 to 77% lower risk of sudden cardiac death with sufficient magnesium. This was a study that involved 88,375 female nurses in the United States. Heart blood pressure, that is, the hypertension levels, drop typically 3 to 5 milligrams of mercury systolic on average, and for some people it drops more. In my case, my blood pressure dropped 10 millimeters. As a reference, I am 61 years of age, approximately 187 pounds. My current blood pressure runs 118 over 65, and I'm 6 foot 3 inches tall. Blood tests for magnesium level are generally not accurate because most of the magnesium is stored in your body. There is a test that tests the magnesium level in your cells. It's called the EXA test, EXA. It's from a Intracellular Diagnostics Laboratory in Medford, Oregon. You can locate it online. They're approved for most reimbursement, and they use essentially a X-ray fluorescent spectrum report. that will tell your doctor if you need additional magnesium supplementation, and also it will advise you if you have too much. Magnesium deficiencies are often caused by our diet, yet stress is the most important cause of deficiency. Magnesium in your body is burned up by the stress you experience every day. And some stress is hidden. For example, just checking in through security at the airport to board a flight can burn up an entire tablet's worth of magnesium. I've discovered that if I take magnesium proactively during a flight every 2 to 3 hours, I will have no heart palpitations and a completely relaxed state of mind. And I have traveled as far as 32 hours on 3 aircraft from Florida to Sydney, Australia in 2013. With proactive magnesium consumption, I never had a problem. Exercise can burn up magnesium. Some players who are on a steady diet of fast foods and processed foods drop dead. Their exercise levels have burned up all the magnesium their heart needed. Potassium does not cause a shortage of magnesium. However, it enables the magnesium to be absorbed properly. 40% of Americans are deficient in potassium. The medications can also include digoxin, ACE inhibitors, and diuretics. These can cause greater magnesium deficiencies by flushing magnesium out of your body. Other forms of magnesium deficiency are caused by antacids, blood pressure medicines, diuretics, corticosteroids, hormones, antiarrhythmics, anti-cancer drugs, antipsychotics, asthma drugs, stimulants like Ritalin, acid blockade medications like Tagamet and Zantac, Prilosec, Nexium, antibiotics, antivirals, and recreational drugs like cocaine, nicotine, and alcohol, and some excess nutrients can all flush the magnesium you need out of your bloodstream. Typically, the body only absorbs 30 to 40% of the magnesium from food. Sources of magnesium can include magnesium mineral water. In Europe, many grocery stores carry high levels of magnesium in their supplemental water aisle. That's fairly rare in the United States. Mivela MG Plus is the only exception. It's available at some stores in the United States. Magnesium mineral water is absorbed straight into the bloodstream through the intestines. The magnesium types recommended for heart failure treatment are magnesium taurate because it is most effective at preventing arrhythmias. More than half of all sudden death cases for heart failure are triggered during an erratic heartbeat episode called a cardiac arrhythmia. Most brands have about the same amount, roughly 112 to 100 milligrams elemental magnesium per tablet. So taking one 4 times a day is 400 milligrams per day. I also recommend taking magnesium malate, 1 tablet per day. That also yields around 100 to 140 milligrams of elemental magnesium per day. Magnesium malate is extremely effective because it is absorbed directly into the muscle cells and it adds ATP, the primary main energy transfer needed by the heart for heart energy and heart output. There will be a recurring theme in this book of all the supplements needed to boost heart power, heart ejection fraction, and blood flow by increasing ATP in the heart. This is something most medications have never addressed. If you find a problem with tolerating magnesium malate or taurate, the third or alternate type is magnesium orotate. This is also a fruit acid-based magnesium that absorbs directly into the bloodstream and increases ATP and synthesis of glycogen in the body. In placebo studies, the survival rate after 12 months on magnesium orotate was 75.7%, or 3 out of 4. Without magnesium orotate, the survival rate was 51.6% in the placebo group. So the clinical symptoms improved in 38.5% of patients taking magnesium orotate. And it declined, their heart failure output declined in 56.3% of persons taking the placebo. Heart failure is a steadily terminal declining illness. Now, these studies included volumes far above what's recommended in this book. You can take more, just keep in mind these are the minimums that have been found and proven effective. There are other forms of magnesium. Magnesium glycinate is absorbed like an amino acid, so it's a very high bioavailability of 80%. Very few side effects, no diarrhea, no loose bowel movements. Magnesium lactate is a time-release kind, which is useful at night if you have arrhythmias in the middle of the night. Magnesium citrate is a high bioavailable of 90% magnesium that absorbs in water extremely fast, 5 minutes or less. If you have a cardiac arrhythmia or anxiety, taking magnesium citrate, even for a Charlie horse, will resolve that situation in 5 to 10 minutes. The most common form of magnesium is magnesium oxide. Very little is absorbed, 4%, maybe even 22%, but most of it ends up causing diarrhea if you take too much. So people who have had problems with magnesium in the past were probably taking a formula with a lot of magnesium oxide. Work with your cardiologist to stabilize your magnesium level and to measure it with the EXA test. And read the book, The Magnesium Miracle by Carolyn Dean, or The Magnificent Magnesium by Dennis Goodman. There are others, but keep in mind this is critically the #1 deficiency for heart failure subjects and most important on your list. My name is J. Randall Wilkerson. I'm author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available on Amazon in print and Kindle editions, at the Apple iTunes Store as an iBooks, and on eBay in print editions. You can also order it from the publisher by Wilkerson and Hughes, P.O. Box 777, Altoona, Florida, 32702. Just send a check for $24 and they'll send a copy right out. Thank you for listening.